Well, hello and welcome to another coronavirus chat. I'm your host, BJ Murphy, publisher of Neuse.com, and want to say thank you to everybody who's jumped on this broadcast already. We've got some major updates across the state and here locally today, and we're going to do our best in a real short time frame to try to get all that information out to you as best we possibly can. I certainly want to start off with an update on the number of cases. This morning, the North Carolina Department of Health and Human Services released that there are 3,221 cases. And again, this was as of this morning. We know there's probably some more since then. It has now affected 90 counties, and I believe today with Jones County's announcements, that will be 91. And unfortunately, 46 deaths. And later, Governor Cooper, we got a chance to listen to the Council of State conference call, and Governor Cooper said, unfortunately, we have lost 46 people to this very cruel disease that almost makes it so people die alone or to get well alone without family being around. So this is a very serious, very concerning time for our country and our state and certainly our own backyard. And just want to say thank everybody for joining us so that you can make sure you try to get some of the latest information, some tips and things that you need to know. So go ahead and please, if you don't mind, share this broadcast with your friends and family to make sure that they keep up with all the latest information. And also, right now we have Diana Kraft from Jones County, if you don't mind. If you have a possible question for her, please, you see her there. She's waiting on me. If you'll drop a line in the questionnaire. Travis, give me just another second. I want to give a couple more updates. But if you won't mind, you'll see that she's there. Go ahead and drop a question if you got one about Jones County or about this disease in particular. Also in the press conference today, Governor Cooper said he is not ready to issue a May stay-at-home order just yet. There was a lot of questions surrounding that conversation because of the model and the data that was released yesterday by the state. And so he said he was not ready to issue a May stay-at-home order yet. But he did give an update on the unemployment. He said that there have been 400,000 applications for unemployment. 110,000 have been approved so far at a cost of $26 million. He did say to expect an executive order very soon, limiting the number of customers in retail establishments. And if we'll drop a link here in a minute, we'll actually post the link to that article that we published this afternoon, and expect to see that executive order sometime in the next couple of days or so. Also, the North Carolina Department of Health and Human Services Secretary Dr. Mandy Cohen announced an emergency child care subsidy program to help essential workers pay for child care. I've got some information about that in the story we published this afternoon. But if you are an essential worker and you are having trouble with child care, there is a program that is being unveiled as we speak regarding that issue. Also, NC senators, including our own Senator Jim Perry, issued a letter to the North Carolina Commerce Secretary Tony Copeland, who is over the ESC, the Employment Security Commission, offering to help find solutions to the unemployment backlog. Just to kind of put this in perspective, between March 14th and March 21st, the state of North Carolina saw a 2,500% increase in applications for unemployment benefits. And so there's obviously, which each of that, there's some red tape regarding how many days you're talking about. And so there's a question between the date of the application and how long an employer has to review it, the change of possibly trying to reduce that time frame to help get the benefit to the unemployed more quickly. So we're looking for some more guidance on that. And also, if you subscribe to our breaking news text alerts, basically just text the keyword NN to 484848. But if you subscribe to those breaking news text alerts, you learned today that Jones County had its first 2 positive cases since this all began. And thinking of Jones County, we invited Diana Kraft, who is the Emergency Preparedness Coordinator, to be with us today. It's a good chance we're going to be joined by the North County Health Director, Pamela Brown. We were having a little technical challenge on that. But Diana Kraft, thank you so much for being here today. Thank you so much for joining us.
Unfortunately, today we did get confirmation that we have 2 positive cases. We do know that the 2 individuals that are confirmed COVID-19 were in direct contact with each other. They were actually tested on Sunday, April 5th, and the confirmation of the positive test results were forwarded to us today. They both are hospitalized at this time. And so some of the things that we just really want to reiterate, because we do know that once everybody hears about positives, we certainly kind of want to make sure that we're doing everything we can to protect ourselves. So I know there's been a lot of information everybody's been hearing coming down from Dr. Mandy Cohen and our state officials, as well as even local officials. And some of the things we just want to remind people is there are methods that have worked with the outbreaks. We're seeing some improvements. I know a lot of the stuff that you're seeing on TV does show that we are still increasing, but certainly we are seeing some improvements with the overall nation of trying to slow the spread of the coronavirus. So what are those methods? Certainly they are things that we should be practicing every single day, but individually we want to make sure that we're reminding everybody hand washing. Certainly making sure that people are staying home while they're sick. The new guidelines from not only the state's Health and Human Services Department, but also the Centers for Disease Control is if you are sick with a mild symptoms, meaning fever or cough, but no shortness of breath, no difficulty breathing, stay home. The requirements of going to get tested, they actually recommend that you are exposing yourself more doing that, going to try to get tested, than just stay home and treat your symptoms. One of the things that we also are hearing a lot about, and a lot of people are hearing about it, is social distancing. We can't stress that enough. And also listening to the governor's order about staying home. If you need to go to the grocery store, if you need to go to the pharmacy, we're not saying you can't do essential business, but certainly we want to make sure people are taking this seriously. So those are just some things we really want to recommend people doing for this.
And thank you so much, Diane. In fact, we've already had a question, and I've learned that we do have Pamela Brown, so we'll bring her on in just a second. But in thinking of testing, there is a question already through one of our Facebook Live viewers. What are the testing sites for Jones County? Is it the health department only? You're talking about primary physicians. Tell us how that system works.
Sure, that's a great question. Actually, right now, Jones County, the health department is not collecting the samples. We actually, if anyone does need to go and need to be tested, it actually would be their primary care provider. Certainly, because there are some things that that provider has to rule out before an individual can be tested. They have certain criteria that they do need to make sure that they're following. So that is something that if they did call us, we would just tell them to make sure that they contacted their provider, and then they can go from there if they needed to be tested.
And a little bit more, because I want to chat about this just for a second. Jones County is unique in that you have a partnership with Lenoir County for your emergency services, your 911 calls. So those calls actually are routed when someone who lives in Trenton or Pollocksville or Maysville, for instance, when they call 911, it actually comes to Lenoir County, who then relays that dispatch there locally. When you're talking about the hospitals that serve Jones County, tell us a little about where they are, because I would imagine you've got 2 or 3 options right there.
Sure. No, BJ, that's a great question. Jones County is a very unique county in that regard, because we do have surrounding counties that have what we call the critical access hospitals. We don't have one here locally in the county. So if you're on different sides of the county, you may go to one of the local hospitals in a surrounding county. So we have individuals who use Craven Memorial. We also have UNC Lenoir. We have Dublin, Vidant, Onslow, and even some of the outliers that would be down close to the Carteret border. They could use Carteret Healthcare. So that is something that certainly it is a little different than some of the other counties, specifically since most of our residents, depending on what side of the county they live in, is going to determine which hospital they may be going to.
And one last question before I bring Ms. Brown on, and I want you to stay with me in case we have any follow-up questions. Are there any, this was another question from one of our viewers, are there any primary care providers in Jones County?
So we actually do have internal medicine in Pollocksville, and we do have a Coastal Children's Clinic in Maysville. So we do have some primary care providers. Here at the health department, we are limited with some of the services because we do only have a primary care provider one day a week, and that's on Monday. So we can see some individuals, but that is something that we have been talking here locally about trying in the future to have more primary care providers locally.
All right. Well, look, thank you so much, Diana. Stay with us if you don't mind, because I do want to bring up Pamela Brown, the Lenoir County Health Department Director. Pamela, are you there with us?
I am. Can you hear me?
I can. Thank you so much. Good seeing your face this afternoon.
Thank you. You too.
So you, based on the amount of releases, you've had a busy couple of days to start this work week off.
We have, yes.
So tell us one question that I've had, in that, because I know I've seen this in some of the threads before, is talk to us a little about a lot of these cases. What we've seen have been related around travel. But if I'm not mistaken, I thought I saw one that was a community spread. Can you tell us a little bit about that?
Well, we, as of our update for today, we now have 11 cases of lab confirmed cases in Lenoir County. And at this time, we have been able to trace the vast majority of those cases to somebody who has traveled, or to somebody who maybe was around somebody who was positive or who had traveled. We're still doing some research on a few of the cases to determine where they may have been exposed. So I'm still trying to, my team is still trying to gather some data about those cases. So I'm not saying that we have community spread at this time, but that's what we're looking for. That's why we do this research on the cases. We want to see, is this a possibility that they were exposed to the disease outside of the county or outside of the country, outside of the state, or is there something a bit more widespread going on within the community?
Yeah, and I appreciate that update. And there's been, in fact, Diana and I were having this conversation before you jumped on, and maybe we can bring her back in. And Travis, you don't mind if there a way to bring all three of us up? Because I really would like that both of you to talk about this question, and that relates to how much information are you actually allowed to give about these cases? Because if I'm at home and I see this news press release, or someone gets one of our text alerts and it goes, hey, there's one or more cases, or two more cases, or three more cases, two things pop in my mind, and one of them is fear, and one of them is being a little nosy, and that is, I really want to know what's going on, but two, have I been where this person has been lately? Can either one of y'all or both of y'all talk about how much information you're allowed to give legally?
Sure. So one of the things from us, and Pam certainly jump in with me, because I know we both are doing the same thing from health departments. We are actually not able to provide a lot of information on the positive cases because of state and federal privacy rules. One in particular for the state is the communicable disease law. It's actually General Statute 130A-143 that actually protects these individuals, which COVID-19 is considered a communicable disease, and being able to not identify their location, information that would basically identify this individual. And part of that is because, like Jones County and Lenoir, we're a very small community, and even the smallest amount of information could identify that individual. I know in previous, some of the reasons why there has been so much of this being pushed and trying to explain why we can't give the information is because in previous counties and outbreaks, that information did get out about the areas of where the people were, and it caused unintentional consequences, not only for that individual, but also the entity that gave that information.
Pamela, anything you'd like to add to that?
Sure. And I think something else that's really important to remember is many times when you're talking about a communicable disease situation, you're not talking about something where you can say, beware of this part of the county or beware of that neighborhood. Because when we're talking about communicable disease, we need everybody to take every precaution every day. So it's just, it may be very interesting information, but it's not very useful as far as keeping people safe. And the other thing to remember is that when the health departments do the contact tracing, when we know that we have a positive, and if there's somebody that we feel is at risk, we will reach out to that wider network as well to make sure that we're monitoring their health. So if there's somebody that we feel, or a particular location or a particular place that maybe has had an exposure, we'll work with that particular area to make sure there are protections in place and people are notified. But again, just messaging a particular part of the county doesn't necessarily make people safer.
And there's a couple of questions. In fact, just leave us both, all three up here if you don't mind, Travis. And that's Dr. Travis Town I'm talking to. He's the engineer behind all this madness that we call a live broadcast. A couple other things I want to mention, though. One, let's talk about test kits, because there's been, over the last 2 or 3 weeks, a lot of conversation about the shortage of test kits, the shortage of this, the shortage of that. Do we still have a shortage of test kits? Are we able to test the number of people that we need to test? Let's start with you, Pam.
Well, testing is ongoing in Lenore County. And so the people have probably seen the testing criteria change over time. And I think sometimes some of that criteria is based on maybe the number of kits available. And sometimes that criteria changes just because the nature of the disease or what we're trying to accomplish with testing changes. So at this point, from my understanding, our partners have test kits. We have some at the health department, and we are doing testing in Lenore County.
And Diana, how about Jones County, about the quantity or availability of test kits?
So the test like Pam said, the testing availability is there. There has been new criteria that's come out that really individuals that are in what we call the congregate areas, like our nursing homes, long-term facilities, healthcare workers, certainly if they start showing symptoms, they are wanting to make sure that they get them tested, just because you've seen in other communities where if one individual in a long-term facility gets it, it certainly causes an outbreak in some of these areas. And also it's in high-risk population. We certainly are also seeing that in our healthcare workers, we need to make sure that they're safe. So there is testing available for individuals, but again, the criteria is changing about making sure. The state has done really well trying to get other laboratories on to be able to test, so it wasn't just coming from the state lab. So certainly our private labs have also been working with us, as well as the the university lab. So that was something that really helped in not only just our communities, but across the state, having more entities that would be able to test for the COVID-19.
And the other question I wanted to follow up with, I said there was two that I knew I wanted you both to try to tackle. The other one is about the evolution of the CDC guidance relating to masks. Are you starting to see more people use masks? Do you concur with some of this guidance? Do you have any further tips or advice you want to give people on their practicing of social distancing in general? Diana, let's start with you.
So I know there's been a lot of conversation about using the mask and going out. And one thing that we certainly want to recommend is if people feel that they need to have that mask, to keep in mind those masks are different, the cloth mask, than a surgical mask. And we still want people to make sure that if they are using something like that, that they're also making sure they're doing the social distancing. One of the concerns that I think a lot of us have in the health is that it kind of gives you that false sense of comfort, thinking that you have that you can't get something, but that is something that we still are recommending, that if people are doing that, you're seeing that more, is that they're still also keeping that 6 feet apart, using the social distancing pieces, because it is something that we are seeing a lot of guidance coming from CDC and different places to do that. But at the same time, it's one of those, we don't want it to be a false piece of comfort for people to think that because they have that, they can't get the COVID-19.
Ms. Brown?
Yes, and I agree. I think that's a key message to wearing a mask. I think that there's still a lot to know about this disease, and so knowing the exact efficacy of a mask may be difficult, but as long as people are not using it to replace some of these other known measures that are proven effective, then it should be fine.
Mm-hmm. Well, look, Ms. Brown, is there any other parting words you'd like to share with us in relation to what's going on in Lenoir County, and any tips you'd like to give anybody before we get off air today?
Well, I think it's just, I just am really so thankful to all the people that are working on these issues, and really to the public as well that are adhering to these guidelines. I think it's really good to keep in mind what our goals are, and so we want to minimize the disease spread, and we want to make sure that we are protecting those high-risk groups, and we want to make sure that we protect our healthcare infrastructure. And so that's why we're doing all of these things that are sometimes uncomfortable and frustrating, because we're trying to add that protection to our community.
All right. Well, thank you, Pamela. I really appreciate you being on and jumping on with us today. Thank you so much. Y'all stay safe over there.
You too.
And Ms. Kraft, tell us a little bit about any other tips you'd like to give us, Diana, and for our neighbors in Jones County.
Sure. I mean, I just want to echo what Pam said in Lenore's. We really want to make sure that we are making, stay with the information that you're getting from these live chats, these live streams that we're pushing out. Certainly, I know there's a lot of information coming down, and it's sometimes hard to understand what's being accurate versus what's not. So really making sure that you kind of go to the respectable resources and just really, follow the orders. These, I know it's frustrating. I know everybody is in some hardships right now, and unfortunately, it is something that we all are facing. But these have worked in other outbreaks, and it's just something that, we're all in this together, and we will get through this.
I agree. Well, thank you so much, Diana. I really appreciate you and your team there in Jones County. Thank you so much for jumping on Coronavirus Chat today.
All right. Thanks, BJ.
Yes, ma'am. And look, again, thank everybody for jumping on. If there was some value in this conversation today to help you, whether you live in Jones or Lenoir County, please make sure you go ahead and share this broadcast. Make sure that we're getting out the accurate, reliable information that you can always trust from your team here at Neuse News. I just want to reiterate a couple of things. One is that just a while ago, Pamela Brown, the Lenoir County Health Director, stated that we now have 11 cases in Lenoir County, so we've added an additional one today. The governor announced this morning we now have 46 deaths in our state, and this is a very fast-moving evolution of news cycle. So if you'd like, if you want to be a part of the breaking news text alert team that we've got here at Neuse News, just send a text, the keyword NN, to 484848. And as we break news here at Neuse News, you'll be among the first to get it before we even publish it to social media, and certainly before it comes out in our newsletter the next morning, which, by the way, we've added over almost 200 people just this week to our newsletter over the last 7 days. And I just want to say thanks to everybody who's subscribing to that. Everything that we do here at Neuse is free, in large part because of our small business and other partners that you see. So if you see an ad either in our newsletter or on our website, please just click on it. Please support that business. Buy some food, buy your medications, support these entities, because they're the reason why we're able to continue to get on the conference calls with the governor or provide these chats like we're doing right here, these coronavirus chats, which I believe this is, if I'm not mistaken, this is number 14. And I'm really excited because tomorrow, a conversation I've been having at the House and around the office for the last 2 weeks, tomorrow we're going to have a mental health expert on this chat. So if you know of a parent with small kids, or you know somebody who's battled depression, or you've seen has some issues here lately, we are going to have a mental health expert on this chat. I'm looking forward to having Beth Sailors, who is a downtown Kinston business owner as well, on this chat to give us some to talk about this very important issue as we have these stay-at-home orders, as we're forced not to congregate like we're typically doing, or going to the Easter service like we would love to do. Because we can't do those things, this has been a topic that I think we all need to take a little bit more heed with. And so I'm looking forward to having her on. As also, we'll have Dr. Pradeep on as well, discussing the latest trends with COVID-19 and coronavirus. So with that, I want to say a big thank you to Pamela Brown and Diana Kraft, as well as Aletha Thor, our VP of Operations here at Neuse and Management Media, for her help on the social media stream and helping to filter these questions. And also to Dr. Travis Town behind the scenes, who does amazing work in getting us prepared for all these live streams each time we do it. So thank you all. Really appreciate it. Make sure you share this broadcast. And as always, wash your hands.